Welcome back, everyone. The time is 12:48. In your health news today, a number of factors can affect bone health, leading to joint replacement.
News 8's medical reporter Jocelyn Mamenta sits down with Griffin Hospital to tell you a little bit more.
All week long, News 8 and Griffin Health are helping you lead a healthier lifestyle. Here to talk about how Griffin Hospital has a handle on your bone health is orthopedic surgeon Philip Minotti. It's great to have you with us, Dr. Minotti.
Hi.
What kind of injuries do you see coming into your office?
I mostly see wear and tear related injuries, sports injuries from time to time, but mostly arthritis, older people with wearing out joints, things like that.
And what kind of treatment do you prescribe?
Well, we try and keep people active, so I start with the simple things, anti-inflammatories like ibuprofen or naproxen, sometimes injections, physical therapy, activity modification, perhaps sometimes being a little bit less active, but ultimately it may lead to more invasive treatments from time to time.
So you start off slow, and
Ideally,
then you basically decide what's not working and what is, and then move on from there.
That's right, that's right. Obviously, if someone comes to see me for the first time in my office, we're not going to start talking about surgery 5 minutes into the visit, because that's not really what people want to talk about for their first visit with a doctor. So we try and keep things a little bit simpler.
Are these mostly injuries related to age, or perhaps they're weekend warrior?
The answer is yes. It's really related to all of the above.
Okay.
Obviously, the calendar doesn't stop for anybody, and joints do age. And as we, as a population, try and stay more active and play tennis and run and do all the things we enjoy, sometimes your body betrays you.
Mm-hmm.
But it's our job to try and keep people involved in the activities that give them quality of life and pleasure.
Now, you specialize on the hip and the knee.
That's right.
And you say the knee is actually something very important because it can cause so many other things.
Well, both the knee and the hip, obviously we're standing on our two legs, so the lower extremity joints are key in our day-to-day activities.
Yes.
Not taking anything away from upper extremity surgeons, but nonetheless, we're walking on our legs, so hip and knee problems affect you in just
all
about everything.
interrelated,
Yeah,
really.
yeah. Even sitting at a desk, you know, hip and knee arthritis can be problematic.
Now, you're doing something different, though, when it comes to hips, and that most surgeons don't do.
That's right. Surgeons perform hip replacements in a variety of ways, and there are certain techniques that make people recover a little bit faster. And there's a handful of us here in Connecticut that do it, but it's a less performed, minimally invasive replacement.
And what is that?
It's called the anterior approach.
Anterior approach.
Anterior approach, that's right. And the idea is that if you can get the joint in there doing less collateral damage, if you will, then people will have a quicker recovery. And like I say, it is performed in a variety of areas in the state, but I'm one of the people that do it. That's right.
Basically, when you say anterior approach, you're going in
through the front.
Through the front.
Through the front. People do hip replacements through the front, the back, or the side. But and again, once people recover, generally, no matter how you put the joint in, if you do a good job, you're going to have an excellent recovery. But if you can get recovered faster, then perhaps it's a bit of an advantage.
What determines whether you're going through anterior or another area?
Well, I just do it through the anterior approach.
That's
solely.
it. That's all you do.
That's right.
Okay.
That's right.
Very good. And knee? And knee replacements, of course, are very common these days.
They're very, very common. It's statistically speaking, it's more common than hip replacement. And the statistics show that knee replacements are nearing 1 million per year in this country. So it's very, very common. And
recovery for many of these treatments, fairly, I think you're trying to reduce the recovery time.
That's right. And recovery from any joint replacement is not a walk in the park.
Exactly.
But through the administrations of physical therapists and patient attitude, it's really not as bad as it sounds.
Yeah, you got to remember there is physical therapy that
Physical
follows.
therapy is very important. You know, a motivated patient is probably the best patient.
Very good, Dr. Minotti. Thank you very much.
Oh, you're welcome.
And for more information, you can go to griffinhealth.org.